Hello everyone, I'm Dr. Yik Yan, the pediatric surgeon. Welcome back to Dr. Says 360. Today I would like to share with you about a story on the ball is dead. What is the ball is dead? Let me share with you a story of a 13-year-old boy who presented to my clinic with 2-day history of left-sided lower abdominal pain. Initially, he was thought to have food poisoning as he is suffering from lower abdominal pain. However, the pain slowly radiated to his groin and localized to his left scrotum. And he started to develop redness, swelling, and severe pain in his left scrotum. He even experienced painful micturition, and his movement or walking aggravated the pain in the scrotum. He was observed at home for 2 days and decided to come for consultation to exclude torsion of testes after the boy and his father actually has done some homework in Google, and they are pretty suspicious maybe his child is having torsion of testes. After carefully examining the child, I highly suspected the child has torsion of testes and advised for surgery. The father requested for an imaging to be carried out, and an ultrasound was ordered, and the finding of the ultrasound was highly suggestive of a torsion with possible infarction and death of the testes. After the child has COVID-19 testing done and proven to be negative, he underwent emergency surgery, which is a scrotal exploration, and the diagnosis of left torsion of testes with 360-degree twist was confirmed. He had left orchidectomy, whereby the left testis was removed, and cross-examination of his right testis found that the right testis is healthy, but he has bell clapper deformity, which is the testis actually lying in a horizontal position, hanging on the broad fan-shaped like tunica vaginalis. This type of testis is very prone to torsion. Hence, right orchidopexy was performed to fix the testis in position. Retrospectively, this boy is actually a pretty smart boy because he knew about the golden 6 hours rule for torsion of testes. He told me that if torsion of testes is suspected or confirmed, operation ought to be done within 6 hours in order to save the testes. He even asked about the prosthesis or testicular prosthesis insertion if his testis is being removed. Bell clapper deformity is a risk factor for torsion, and this is found in this boy. Most of the time, the cause of torsion is idiopathic, and it commonly occurred during puberty, particularly if the height of the growth spurt, where rapid elongation of the vas structure make the testes prone to torsion. Therefore, this is very important for me to bring to your attention. If you have a boy at home and he is actually at his puberty age, he starts to experience swelling in the ball with pain, and looks red hot and tender, you have to exclude torsion of testes because the outcome is dreadful if you miss it. And the golden rule of 6 hours applied started from the time the boy experienced severe pain, and it has to be explored, and the torsion has to be done in order to save the testes. In the same procedure, usually we will fix the testes if we are able to save the testes. In unavoidable circumstance where the testis is dead and being removed, prosthesis can be inserted at a later period, usually proposed at the age about adulthood around 18 years old. The differential diagnosis for a painful scrotum or testis is torsion hydatix, cyst of testis, epididymal orchitis, or orchitis. All these three conditions can be treated with antibiotics, and painkiller. However, if you are unsure of the diagnosis, an exploration is actually crucial to exclude torsion, as missing a torsion of testis can lead to you or your boy losing a ball due to the death of the testis after prolonged torsion. This is therefore very important. If you have a boy who experienced tummy pain and the pain slowly radiating or localized to the private part, please have a look at the ball. If the ball is red hot and tender, please bring him to the attention of a doctor and to make sure this is not torsion of testis. This is all I have for today, and hope to see you soon again in Dr. Says 360. Until then, bye-bye.
If you like our channel, please like, share, and subscribe.